Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Is this rise being driven and spread primarily by children?
They're part of it. It's being driven by unvaccinated people. That's what is happening. And in the younger kids, under 5, there's no vaccine, so they can still get it. They typically don't get that sick, but it's not like they don't ever get sick. And then in the next group that just got approved for the vaccine, 5 to 11, they're only about 12% vaccinated yet, but that just started. That's great. And then the teenagers, above that, they're doing much better in terms of getting vaccinated. So all the unvaccinated people are driving this, including the adults that don't want to take it.
So the COVID death toll in the U.S. in 2021 has now passed the death toll of 2020. A lot of people might find that surprising since the vaccines came on board in 2021. Explain that.
Yeah, well, remember when this thing started, it wasn't just a pandemic overnight. We're saying all of 2020, people were still flying around and there was hardly any lockdowns up until the middle of March. And then when we saw the explosion in the Northeast, particularly New York, things got serious and everything shut down. So you have the first couple months of the year where there wasn't too much activity that, of course, picked up. And then we still have too many unvaccinated people. And then we have the breakthrough cases because of Delta. And so the most vulnerable of all the population are now at risk, and they're in the hospital too, and some of them are dying.
All right, let's get to viewer questions. Here's the first one. My 21-year-old son got 2 doses of the Pfizer vaccine in April for his booster. Should he avoid Pfizer or Moderna because of the possible heart inflammation side effect? Considering this, should he get the J&J?
No. This young man has tolerated this mRNA vaccine, the Pfizer vaccine. That's great. There's no reason why he shouldn't have it or the Moderna vaccine again. Those vaccines are more potent than the Johnson & Johnson vaccine.
All right, next question. Is it safe for masked, unvaccinated, under 5-year-old children to visit Santa at the mall?
Okay, so vaccinated, those kids can't get vaccinated, all right? They aren't a huge part of the epidemic. It's the kids that are going to school that are more likely to be infected. So if Santa is vaccinated and he's received his booster and his little helpers are all vaccinated and everybody wears a mask, it should be okay.
All right, here is the next question. I am a healthy 54-year-old and had an anaphylactic reaction to my first Pfizer shot in April. My doctor advised against getting a second shot. What are my options aside from boosting my own natural immunity? Is it safe for me to attend my niece's destination wedding in Mexico at the end of the month?
Oh, this is a tough question, but anaphylaxis is severe. This person should never take the Pfizer vaccine. Now, so you have a choice in vaccines. You've got the Moderna vaccine, same type of vaccine, but it's a different vaccine. So perhaps you could take that. The Johnson & Johnson is very different. And most of the problems with the Johnson & Johnson, these blood clots, are in women under 50. This person is over 50. So it would be, I think, prudent to consider the Johnson & Johnson one. You and your doctor have to make a decision. But because you had anaphylaxis to a vaccine at all, I would make sure you did that in a hospital, not in a pharmacy or a remote clinic.
All right. Thanks, Dr. Murphy. If you did not get your question answered by the doctor, he does answer them biweekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page and post one there. Have a good day, doctor.
Have a happy Thanksgiving.
Yeah, happy Thanksgiving to you both.